Generalized anxiety disorder, or if you want to abbreviate it to GAD, is a psychiatric condition that actually is pretty prevalent. If you ever have heard of the Diagnostic Statistical Manual, or the DSM, what it outlines is a period of at least 6 months of anxiety in which it interferes with your social functioning, which is your ability to go out, have conversations, be in crowds, also your work functioning, in everyday life. So it's anxiety symptoms that really are in excess of what you would think would be the result of being in any of those situations. Symptoms related to generalized anxiety disorder are basically general nervousness, somebody who worries for most of the day about even detailed small things that most people wouldn't consider requiring worthy of worry. You would also have attention concentration difficulties, fidgeting, sleep problems, oftentimes getting to sleep because you're worrying about things that you need to do the next morning or things that you used to do, and irritability and muscle tension. Those are pretty much the main things related to generalized anxiety disorder. And if you have these symptoms, more so than not, for at least 6 months, and they interfere with, again, your ability to socialize, your work, your school, those kind of performances, that is a fairly quick rundown on whether or not you would qualify for a diagnosis such as generalized anxiety disorder. Approximately 2% of the US population, or about 6 million people, suffer from. And the reasons why it exists are really unknown, other than there is a family genetic component to it. So it oftentimes will run in families, although individuals who have a high stress life, who are also perfectionistic, oftentimes will experience symptoms that sometimes are associated with generalized anxiety disorder. Individuals who have generalized anxiety disorder would possibly benefit from new upcoming clinical trials, because the current medications out in the market are only fast acting and oftentimes addictive. So current research trials are out that are looking at longer acting medications that will not be addictive and will last longer when taking the medication in order to treat the anxiety symptoms. If you think that you are suffering from generalized anxiety disorder, or that you've already been diagnosed, we currently have research trials that are occurring here at Clinical Trials of Texas, and you would be able to participate either in the actual trial or a free screening by going on our website, which is saresearch.com, and entering information in which our recruiters will then contact you. Or you could give us a call and you can speak to somebody in real time to actually set up an appointment to see us.